First and foremost, I'd like to thank all of our wonderful speakers for participating today. We appreciate your participation in this and in providing your commentary on this important topic in our last event before our annual conference. So we appreciate you coming today and speaking with us. I also would like to recognize our wonderful Workgroup co-chairs for helping us put this event together. We would not be able to do what we do without them. So I'd like to thank Laura Ho and Stephanie Vasquez, who are the Health and Nutrition Workgroup co-chairs, and Matthew Bremen and Christy Olenek for the Youth and Development Workgroup. So we appreciate everything they do to help make these events possible. I don't want to take up too much time because I know we have a packed schedule, and I'll get to having Laura doing her introduction in a moment. But I want to just plug our annual conference, which is coming up in, believe it or not, 3 weeks' time. So if you have not signed up, registration is now open on our website. So please feel free to look there for everything concerning the conference, from our agenda to sponsors, as I said, purchasing tickets, anything conference related is on our website now. So feel free to check that out. It's shaping up to be a really great day with some pretty big name speakers. So check that out. And the only thing I'll mention with regards to the event, this will be like any of our other events that we've done during the pandemic, but the one thing I'll just point out is please don't be shy to send questions throughout the course of the event. We will be monitoring the chat throughout the entire event. So if you have a question at any point in time, feel free to drop it in there and we will address the question towards the end of the event. We have some time for audience Q&A at the end. And with that, I will hand it over to Laura, who will provide the context for today's event.
Hi, thank you so much, Paul. As Paul mentioned, I'm Laura Ho. I'm the Director of Strategic Initiatives at the International Rescue Committee, and along with my co-chair for the Health and Nutrition Workgroup, Stephanie Vasquez, we've been working with Matthew Bremen and Christy Olenek who are the co-chairs of the Youth and Development Workgroup. And we're really excited about this event, which will be highlighting some great youth advocates for family planning. I really want to get to them speaking, so I'm not going to really take up too much more time. I will mention I will be stepping down as co-chair, so if you're interested in getting involved in SID and the Health and Nutrition Workgroup, we will be recruiting someone soon. So with that, I'm going to hand it over to Shaylin, who's going to be moderating our session today.
Great. Thank you so much, Laura. And it's really great to be here. My name is Shaylin Stanley. I work at Pathfinder International as our Next Generation Engagement Officer. So it's a really fun way for me to connect with young leaders and change makers like the panelists that we have in today's conversation to talk more and find new ways that this next generation, or Gen Z and Millennials, are really able to engage with the issues that they care about and gain the skills and information that they need to then be really informed and empowered activists and change makers. So it's really wonderful to be here today with our three panelists and hear more about their story as it relates to sexual and reproductive health and how they're involved. But before we jump into them, I'm also really excited to welcome Dr. Elizabeth Rowley to share more background about the challenges that young people face related to their sexual and reproductive health, and how we can address what's often such a taboo topic and really ensure that we're having the conversations that we need to have around this issue. Elizabeth has over 20 years of public health research and program experience around the world. She's currently PATH's Global Advisor for Gender Programs and Research, where she leads capacity building and gender integration across PATH programs. But with that, I'll hand it over to you, Elizabeth, to do our opening.
Thanks so much. And thank you for inviting me to participate in this event. I'm really excited about it. I'm really excited to hear from the speakers. And so I'm just going to, in the next few minutes, provide some data points around adolescent and youth sexual and reproductive health, focusing on issues related to family planning as a framing for the rest of the discussion that will hopefully be helpful. Just two overarching points to start off with. First, in many ways, I think the numbers speak for themselves. The sexual and reproductive rights of youth in many low and middle income countries are not being met. And this has serious consequences for youth today and in the years to come at both the individual and collective levels. And second, a caveat simply that, as we know, youth are diverse and the experiences and needs of youth vary based on geographic and socioeconomic contexts, age groups, marital status, ethnicity, gender identity and expression, mental health status, disability status, and many other factors. Some of the data cover diversity and experiences and needs, and some do not, and there are a number of data gaps. So I think to frame discussions, it's helpful to take a look at some of the overall trends in adolescent pregnancy. The UN estimates that the global adolescent birth rate, which is the annual number of births to adolescent females aged 15 to 19 per 1,000 adolescents in that age group, has decreased since the early 1990s globally. The global adolescent pregnancy rate for 2019 was estimated at 42.5 births per 1,000 adolescents aged 15 to 19. And that downward trend has been driven in part by a steep decline by about 72.5% in Central and Southern Asia, from 95.3 to 26.2 per thousand since the early 1990s. Adolescent birth rates in sub-Saharan Africa and Latin America and the Caribbean remain the highest worldwide at 104 and 63 births per 1,000 adolescent girls, respectively. Within Africa, there's considerable variation across countries, and if you look at national data, one typically sees subnational differences as well. And this is evident in the map with the different colored countries in sub-Saharan Africa, as well as Latin America and the Caribbean. Data also indicate that a large proportion of births to adolescents are unintended, meaning pregnancies that are reported to have been either unwanted, they occurred when no children or no more children were desired, or mistimed. They occurred earlier than desired. Next slide, please. So taking a closer look at factors related to unintended pregnancy among adolescents in sub-Saharan Africa, in 2018, Ibrahim Yakubu and Waliu Jawula Salisu published a systematic review of both quantitative and qualitative studies addressing factors associated with unintended pregnancy among adolescent females in sub-Saharan Africa. And based on their review of the research literature, they identified key determinants for unintended adolescent pregnancies in three main groupings. First, sociocultural, environmental, and economic factors. Second, health service related factors. And third, individual level factors, as you can see in the slide. So I think we're going to hear much more about some of these factors from today's speakers, which are definitely not restricted to the sub-Saharan Africa context. These are also critical barriers to youth access to family planning information and services, and by extension, barriers to their rights in South Asia, the Caribbean, and other geographies as well. Next slide, please. So globally, the modern contraceptive prevalence rate for adolescent females, which is defined as the percentage of adolescents age 15 to 19 years, married or in union, who are currently using or whose sexual partner is using at least one modern method of contraception, has doubled between 2009 and 2019 and currently stands at 21%. Again, there are big regional differences, 57% modern contraceptive prevalence rate for adolescent females in Latin America and 15% in sub-Saharan Africa. So it's also helpful to look at some of the data for unmet need for family planning among adolescents, which is defined as the proportion of adolescents age 15 to 19 who are married or in the union and who have an unmet need for family planning, meaning they do not want any more children or want to wait at least 2 years before having a baby, but are not using contraception. And data collated by the Guttmacher Institute shows that there's a massive unmet need for family planning, including modern contraception among adolescent females. So out of 32 million adolescent women in low and middle income countries who want to avoid a pregnancy, 14 million, 43% have an unmet need for modern contraception. And that is, they want to avoid a pregnancy but are not using a modern method. Guttmacher also reports that 85% of adolescent women in low and middle income countries with an unmet need for modern contraception are using no contraceptive method at all, while the rest, 15%, rely on traditional methods such as withdrawal. For many adolescent girls and young women, there are serious physical consequences of unintended pregnancies, of course. For some, this includes unsafe abortion, and for others, early childbearing, both of which carry significant physical risks. Pregnancy and childbirth in adolescence are among the leading causes of death in adolescent females. And there can also be critical social and economic consequences, including negative impact on the likelihood of school completion and work-related opportunities. Many of the factors associated with adolescents' unmet need for family planning have been mentioned before in the previous slide that highlighted factors related to unintended pregnancy. Including, among other things, gender norms and unequal power in relationships. So power imbalances and decision-making within relationships, including relationships of married or unmarried adolescent girls and young women to older male partners or even same age male partners, can be barriers to family planning use. More specifically, some adolescent girls and young women experience limited autonomy in decisions about sex in general, including with whom, when, where, how, and may experience coercive sex, as well as limited autonomy in decisions about family planning needs. And in many contexts across all ages, but perhaps especially for adolescents and youth, decision-making about contraceptive use within marriages often lies with men, their husbands, and in some contexts also in-laws. Stigma and taboos are also in many contexts a major barrier. There's in some settings strong taboos around talking about the human reproductive system and sex in general, which contributes to limited information geared toward adolescents about contraception. There's also stigma, again, tied to gender norms about what is a socially acceptable behavior for adolescents that undermines their access to information and services. This often takes the form of family, community, and sometimes also health worker, social disapproval of adolescents. Again, especially unmarried female adolescents having sex at all, and therefore having need for contraception. When there's limited access to accurate age-appropriate information, myths and misconceptions about contraception can flourish based on misunderstanding details of human reproductive functions and how contraception actually works. Many female adolescents have knowledge gaps and misconceptions about menstruation that cause fear and anxiety and leave them unprepared when they start menstruating. Many males also have knowledge gaps about human fertility and family planning methods. In a research review by Munakampe, Zulu, and Mikelo of 21 studies highlighting adolescents' knowledge of contraception and abortion in low and middle income countries, noted that across these 21 studies, adolescents had poor, limited, incomplete, and sometimes wrong knowledge and information about contraception and abortion. They also had poor sexuality or sexual reproductive health information, in particular about how conception occurs, and this caused misconceptions or incorrect information regarding contraception. They could also they also could not effectively adopt safer pregnancy prevention strategies and other good reproductive health practice due to that low knowledge. And this brings us to access to comprehensive sexuality education. So because of these factors, many adolescents, both male and female, lack information they need to manage their sexual and reproductive lives. This is one of the fundamental challenges, and although there have been advances over the years in the legal and policy frameworks that promote adolescent rights to comprehensive sexual education, translating this into quality programming and tangible results in terms of knowledge improvement and the ability to act on that knowledge remains a significant work in progress. So as I said initially, I think the numbers speak for themselves. These and other data points clearly highlight the urgency of meeting the family planning needs of youth. I'm speaking of the health imperative and a rights imperative for all youth, regardless of where they come from, their socioeconomic background, gender identity or expression, or other factors or other characteristics. We have very little information on the additional barriers that gender nonconforming adolescents in low and middle income countries face on accessing family planning services, but these are likely to be even greater. Responding to the health rights imperative for youth today also contributes to the future health of families, communities, and societies in terms of overall health and economic progress. And there's been progress, as we've seen with some of the data, but the global youth population is obviously large, and the needs in absolute numbers are going to continue to grow. So I think as we hear about youth-defined priorities and demand for family planning, some of the questions we need to be asking now are, how do we understand the true impact of these gaps? Numbers are one thing, but what does that look like in the lives of youth? And why do these challenges persist? Many of these challenges are not new, especially around myths and misconceptions related to contraception. We know that some of the same myths that persist today about how contraception works or doesn't work have been noted in various communities and contexts for decades now. So why has it been so difficult to address this, and how do we make improvements for youth and for all individuals and couples? And most importantly, how do we move forward? How do we collectively define a vision that will really work? So I'm really looking forward to hearing more about this from today's highly accomplished speakers and who are so well placed to lead the discussion. Thank you.
Awesome. Thank you so much, Elizabeth. That really, I think, helps us frame the conversation. Obviously, globally, there are so many challenges as it relates to sexual and reproductive health and rights and access to services. So agreed. Very much looking forward to hearing from our speakers around the areas and challenges that they face. And for the audience too, we're going to walk through some questions and have this conversation, but we'll leave time at the end for Q&A. I know that the event organizers put a note in the chat, but please feel free to drop any questions that you have from our conversation there, and we'll be sure to answer them at the end. So now I'm really excited to welcome Saba, Khadija, and Damilola. Just with quick introductions. First, Khadija Moore. She's an advocate for sexual and reproductive health and rights, specifically around gender equality and gender-based violence. She also recently graduated. She was studying political science and gender studies. So congratulations, Khadija. But over the last 10 years, she's been really involved in government and also health education on her home island of Dominica. So I'm really excited for everyone to hear more about her experiences there. Next, we have Damilola Samuel. Damilola is a social entrepreneur and feminist from Nigeria, and he has spent the past 6 years working to improve availability of feminine hygiene projects and information related to feminine hygiene among schoolgirls and through his company, Green Pad Concepts. And then last we have Saba Hussain. Saba is a first-generation Pakistani American who is very passionate about the right for all women to own their own decisions about their reproductive health. And she's deeply involved in various initiatives at Pathfinder International, including by serving as a member for Pathfinder's President's Council, and she's also a founding member of Pathfinder's Next Gen community, the Akeisha Circle. So Saba, Khadija, and Damilola, welcome. I would love for you to each share a little bit more about what sparked your decision and your interest to get more involved in the sexual and reproductive health and rights space. maybe starting with Saba, would you like to jump in and share more about really what got you involved?
Sure. Thanks, Shaylin. As Shaylin mentioned, I'm first generation Pakistani American. So, being born in America, visiting Pakistan since childhood, there was always this constant counter perspective that I had. And as I got older, I really noticed the discrepancy between my access to health services, to products, to information, in comparison to women who were just like me, just living in a different environment. And I learned about Pathfinder through Lois Quam right shortly after she joined the organization, and learned about their incredible work, not only in Pakistan, but in over 20 other countries with similar challenges that are affecting women and girls. And it really opened the door for me to this community where I could channel my own experiences and work to eliminate the discrepancy that I've seen.
Wonderful, thanks, Saba. Maybe Damilola, do you want to jump in next?
Yeah, thank you so much. My name is Damilola once again. I starting up my career as an agripreneur. I noticed a pattern among rural school girls, as in they used to miss classes for about 3 to 5 classes every month, and due to number of absenteeism in school, they do drop out of school, and sometimes most of them they get impregnated by one roadside mechanic or poor farmer's child like them. So this makes rural girls to continue in the same level of poverty with their parents. And fortunately for me, on a fateful day like that, I was able to board the same bus with one of the community teachers. I challenged her, why is that your girls are most time out of school? So she explained to me that these girls miss school every month due to their lack of access to sanitary pad. And I was like, this is serious. We have to create a solution to this. We have to ensure that girls are kept in school to have equal access to education as boys, so that this will help them to reach the peak of their career. And that's how it all started. Thank you.
Go ahead.
Hi, everybody. Thank you for the introduction. So basically, my story is kind of similar to Saba's, where she mentioned access to information and to products and services relating to sexual and reproductive health and rights. So I'm from a small island, and it's predominantly Catholic. So there are a lot of taboos surrounding sex and sexuality. So while I was in high school, I noticed that they were only teaching us like an abstinence-based approach to sex. They only taught us the biological aspects. They didn't teach us anything about relationships or consent, LGBTQ plus things. They didn't teach us any of that. It was just like abstinence-based, and it wasn't really anything that could help us. They didn't provide any tools for us. So I got involved in the family planning movement and the IPPF. Just because of that, I wanted to have more information. I wanted more information to be provided to young girls and young boys about their sexual experience, their sexual health experience. So because of the taboos and the stigma that came along with this, this small island mentality, I decided to join the Planned Parenthood so I could basically help more young people get the tools that they need to be equipped so they could live their lives in a better way, basically. Thank you.
No, that was a great segue to Khadijah, because I would love to hear more maybe from Saba and Damilola too about what that process was like getting involved. And Khadijah, if you have more to add too. So you've been able to identify these different challenges, and then you started to take action. I would love to hear more about what that process was like and how you got involved and what you've been able, maybe like specific skills or a deeper understanding, what you've been able to gain from that too.
So can I jump in?
Of course.
Yeah, thank you so much. So like the project I said, starting up as an agripreneur, I noticed this pattern that most times girls do miss school for about 3 to 5 days every month. And I didn't know this actually from the inception until I met one of the teachers I challenged, and she explained to me that the problem is much more than just missing classes. It's as far as causing these girls dropping out of school, causing these girls, it's that they use unhygienic materials during their menstrual period. That is why they try to avoid embarrassment in school, and that is why they try to stay at home for about 3 to 5 classes. And as a result of absenteeism, it causes them to repeat classes, to lag behind their peers. Not just that, these girls, they have they have options, and we have to like encourage these girls to overcome their hurdles. What actually happened is I have to look for a means to start this project, and the idea was not fully shaped. I started by raising funds locally from my personal pulse and friends and family to buy sanitary pads for this girl, but trust me, it wasn't sustainable. And that's how I discovered how to manufacture sanitary pad from plantain and banana stem fiber. And that's how it all started. I have to partner with school teachers because as being a man, it was challenging. They don't allow me to speak on feminine hygiene. And trust me, feminine menstruation is a taboo in most communities. So they don't teach menstruation in school. They don't teach feminine reproductive system in school. And most parents, they don't teach their children. So these girls just find themselves menstruating. They don't know how to go about it. And that's how the idea of sensitization comes in. So we have to go to school, we educate these girls on proper feminine hygiene, on menstruation, on reproductive health, and we let them know how the unhygienic alternative they practice, how it could damage their reproductive system, and how this could cause harm to their health as well. So we let all this clear to them, and we partner with teachers, school teachers, we partner with community, school authority, we partner with community elders and parishes, church parishes. So we go out, we do this everywhere. And as to make this more effective, we introduce our biodegradable sanitary pads to them, which is the product we produce, green pad. We share for free. We partner with organizations that have funding to push this sanitary pad for free to the girls. And that is what we do from here in Nigeria, green pad concepts. Thank you.
I can jump in next. Thanks, Damilola. So just in the formal way that I feel that I got involved was with Pathfinder. I think that's been the most accelerated channel for me to take action. I do think a lot of the experience that I've had has related to just starting the conversations with not only, my sibling, my parents, my family, the diaspora in America, just other friends and family that have similar experiences being first generation. So really learning about, what my mom's experience was with family planning to, my sister, and then also speaking with cousins that are back in Pakistan. And I think that, like you said, Damula, the stigma also became very apparent to me because even with my family or friends, I felt this innate kind of uncomfortableness when speaking about it, even in a very informal way. So that brought to light a lot of the ways that I hadn't really been aware of my experience being a bit more privileged. And I think that even with events that we've had and trying to engage with the Pakistani diaspora, there's an emphasis on using the right vernacular as to not, deter people from being or having them feel uncomfortable in the same way that the stigma obviously makes people feel. So that's been a learning process for me. I would say I'm just at the beginning. I wouldn't say I'm an expert in how I've broken into getting involved, but it has been a journey so far.
Thank you, Saba. As I mentioned earlier, the island is predominantly Catholic, so most of the opposition comes from schools and also parents who feel that teachers or sexual health educators don't have a right to teach their child about sex. They think it should be like their job, but they don't actually do it because they too receive little to no information about sex and their sexual health, any sexual health information. And that is because it's basically a culture of silence. And we basically live in a society that tells you don't speak about sex because it's it's an action between a cis man and his cis wife, you know. They don't teach you anything else because they don't know sometimes, or they just feel too uncomfortable to share. So most of the parents too had to experiment to learn. So they have no idea what they're telling their kids if they ever do, you know. And this is something that we're trying to eliminate with the Planned Parenthood organizations. That's why we go into the schools and we teach basically comprehensive sexuality education. So we would do it in an age appropriate manner. If we're going into preschools and kindergarten, we teach them about good touches and bad touches. We teach like elementary school level kids how to say no. We teach them what consent is. And the older they get, the more information becomes available to them. I remember once I went into the family planning clinic, and by the time I got home, someone had called my mother and told her, I saw your daughter at the family planning clinic. And they were concerned. And they were concerned because they were worried that I was basically taking care of myself. And I think they should have been cheering me on or applauding my efforts as a young person, you know, trying to receive the information, trying to receive products. And my mom had no problem with me being there because I was a part of the youth group. I served on the board of directors, so she knew what I was doing. She knew what I was up to. I was basically seeking information, trying to educate other young people. And it was amazing to hear the person who said it, you know, your daughter is over there, and they're like kind of scared and kind of worried that I'm there, but they should have been applauding my efforts, you know. So we just know that a lot of the barriers come from the taboos and the stigma that's related to sex and sexual health. So that's what we've been trying to do, like basically crush the barriers, break down the opposition. We also have like opposition from the government, and it's a lot. But as advocates, you have to push, and you have to push hard. So that's basically what I've been trying to do these last 10 years, just push hard and fight hard so that we can have better access to information and products and services relating to family planning.
Yeah, it definitely sounds like just the topic itself and how taboo it is and uncomfortable it is to talk about it with so many different people is really one of the biggest challenges. And I'm also curious in your experiences if there have been key individuals or stakeholders that have helped you overcome that challenge, or organizations that you really are thankful for their role that they've been able to play to help you overcome that taboo topic and really thrive in the work that you've been able to do.
Yeah, I could go ahead. So yeah, definitely Pathfinder for me. I had the privilege of working with the country director in Pakistan, actually, and hearing from she was born in Pakistan and works in the community with Pathfinder. And so hearing a different view into the work that's being done from her perspective, as opposed to me being first generation and someone who comes and goes and visits and isn't living it, was really eye-opening. I think that it provided me with a lot of tools to be able to promote and engage in advocacy here in America and engaging with the diaspora here. So Pathfinder being my one tool is definitely the one answer for me.
Yeah, thank you. So what we do is we partner with school teachers and community leaders. We partner with women-led organizations, and how we're able to reach out to women and girls, especially when we talk about school girls. We're able to partner with teachers because that's the only age we have to reach out to these girls. If we are to be talking to them one by one, it won't be effective. But we reach out to them hundreds in schools. We reach out to them in hundreds in number in schools, on assembly ground. We educate them on proper feminine hygiene, on reproductive health, on how they can, on sex education. It has really helped, and we're able to partner with other organizations that have network of women. So this helps us to educate them and we provide them with relevant information needed. Not just that, we as well recommend near health facilities to them where they could easily go for medical checkup, where if they have any infection, where they could easily get treatment, proper treatment. So we recommend our health practitioners to them. Also, we go to churches, we go to mosques and religious bodies. So they open the floor to us. So after the service, they let the women wait. So we educate them. We let them know effect of all these things, and as well, not just the women, as their girls. So this is how we have been able to have an edge to reach out to the right audience. Thank you.
I've also had the opportunity to work alongside with and under numerous organizations that have helped both me personally and people in my country. So apart from the Dominica Planned Parenthood Association and the Caribbean Family Planning Affiliation, which are both located in the Caribbean, the International Planned Parenthood Federation also provides us with tools. Women Deliver also provides us with tools. You know, over the last 4 to 5 years, I've received dozens of training opportunities. I've been to conferences that basically equip me to with the tools to go back home and help many local organizations too. I have to say many thanks to them because the Cancer Society, the Women's Bureau, you know, the Bureau of Gender Affairs, basically also pharmacies back home, they also play a big role. They do a lot to help us in whatever ways possible, be it with transportation, items for like food stuff during poster campaigns where we go into communities. We do health clinics with various health centers across the island just to get the information out. So it's really good, all the energy that comes from just local organizations and other stakeholders back home. I have to give them basically a huge thank you for all the help they've provided, not only myself and Levi Dominic or the Planned Parenthood with, but basically all the young people in Dominica who have these tools now to better help themselves. Thank you.
You know, all three of you have had such different journeys and experiences in your own education process and advocacy process and small business process. And I'm also curious if there were key moments throughout your journey that have been really motivating for you and have really kept you going, whether the key milestone that you've reached or a success or even an obstacle, because I'm sure sometimes it can get tiring to not see results as quickly as you want to, or to continue that energy and keep things moving. So I would love to hear if there have been those key moments that have really kept you motivated and determined in this space.
Okay, I'll just start off. As we all know, advocacy can be really draining. And when you're in this for such a long time, you feel really overwhelmed, especially with all the stories that you hear. In 2016, when my co-founder and I launched it, Levi Dominic, we did so to empower people to speak up. Like I said, it's these issues get swept under the rug. Domestic violence issues, intimate partner violence, anything related to family violence, it's kept to basically a minimum. You know, you don't hear much, or there's outreach for 2 days and then everybody forgets about the issue after. What we did with Levi Dominic was it went from a social media campaign to a full-fledged organization. So currently, we don't only want to help people through basically one way. We want to help them in multiple ways. So the survivors of gender-based violence, the survivors of street harassment, abuse, molestation, we tried to turn them into advocates or help them receive counseling. We also did yoga sessions a lot because that helped, you know. So we don't only try to help them by letting them speak up, because they're gonna ask, what's next? Okay, I've shared my story, but what can I do next? You know, so they also want to help other survivors who are too shy or too timid to talk, who are too scared to speak about their experiences. So we took a step back and we decided that we're not just only going to have this for like 1 or 2 days or 1 or 2 weeks. So the following year in 2017, we did a women's march, and we marched through the capital city. And I think that was a defining moment in my advocacy, because you saw everyone coming together, younger people, older people, men and women alike, children, everyone from all walks of life, just coming up to us, getting their t-shirts, walking around with their purple balloon. It was a Women's Day march. So it was just very satisfying to see everyone who came out to support us and to support the survivors of these things that people don't want to speak about. So that was really gratifying to me. It was a satisfying moment, and it really pushed me to continue what I was doing, because a lot of times you feel like you want to give up because change is limited or change doesn't come as soon as you want it to. But you just have to work harder and push harder and keep doing things that motivate you and the people that you serve.
I love that story,
Thank
Khadijah,
you.
about the Women's March. When we were preparing for this too, that was such a standout to see how enthusiastic you were around that, but really how much energy that getting such a big group together and supporting each other around these issues and their experiences was. So thanks for sharing. Damilola, were you about to jump in?
Thank you. I was about to jump in. So what I want to share actually is when I was when the idea seems too big, when the dream seems too big for me to achieve, because I have created a platform, a floor that enables the marginalized women and girls to see the idea I have. As a matter of fact, I have created a network for the women to form a cooperative that will be extracting the fiber and they will be selling it back to the green part concept. So all these things have been put in place, but there was no funding as such coming in to kickstart the idea. Then it seems too big. Even people around feel I can't achieve the goal, I can't achieve the dream. But fortunately enough for me, I was able to raise some little capital to kickstart it, and gradually it was moving. So it's highly impressing, it's highly encouraging. And most times when the lives we impact, whenever we are talking to the women, whenever we are paying the women from the fibers they extract, they sell to green part, all these things, they are the ones that give joy to me to keep on pushing the dream. These are the things that keeps the motivation. They are the fuel that keep propelling the force. Because when we see the lives, when they give their feedback, their word of thanks to us, all these things, they are the propeller that keep us moving. Thank you.
Those are great stories. Thank you guys for sharing. I think my motivation has been more of the obstacle route. My timeline of learning about health service has been pretty privileged. I understood it as my right. And with the last administration's impact hitting me personally, I think that very much underscored that it's not something that's seen as a right even here. So a lot of the focus that I had was, places that were more developing, that needed more assistance, more education. They were relatively, not as progressive. To see those impacts be happening, with the Global HER Act and some pretty incredible laws come into place that impact us in 2021 were very much my motivation to keep fighting. This is not something that we can rest on our laurels about. It's not something that anybody is immune from. It affects everybody. And unfortunately, we're not in a place where it is a right for everyone. And so it's just realizing how much further behind we are than I originally had understood has been my motivation to keep going.
Have in all of this different advocacy work that all three of you have really done in different ways, have you identified that there are particular ways that you as individuals, or maybe even using your affiliation with your like Green Pad concepts, for example, Damilola, or with Planned Parenthood or with Pathfinder, where your advocacy is really able to be the most effective, where you as an individual are able to generate that momentum in the advocacy space for access to services and for sexual and reproductive health rights?
Thank you. The advocacy, actually, when I first started the advocacy program, that it was really challenging because I was rejected in schools. What they say is, you are a man. What is your problem with this menstruation, feminine hygiene issue? So I was frustrated. I felt bad because I wish I keep on pushing this. I wish I educated the girls, and there was no way forward until I spoke with my mentor, a mentor of mine in Kenya. So she explained to me that in a situation like this, as a man, you have to bring a lady, and you need to have partners, a lady that will open the floor for you. And honestly, it really works. Then I have two partners, the two of them are female. So what they do is they are the one that address the school authority, they submit the proposal, they open the floor, then they bring me on board. And that is how it all started. It was like magic, seriously. It was really challenging initially, but now it's really encouraging. And the most good part of it is that these women, they are even now doing much better than I myself. They are highly more fantastic. You know, it's most of their things. So they know the loop and corners to mention. So they do it better, and we all do it collectively, and we are achieving great results. We have a network of women and ladies, both Rivers State and Ondo State, that do this advocacy for women and girls. Thank you.
Thank you so much, Damilola, for sharing. And I think then too, so now as we're thinking about our friends and others that we want to get involved in our work, or spread more awareness around, or ensure that they're getting the education they need, I would also love for you all to share a piece of advice that you have for one of your peers that's also trying to get more information or trying to develop new interventions so that their peers have access to services or drive those advocacy efforts. A tip or a piece of advice that you might give them.
Yeah, I could jump in really quick. One of the things that I've found in just speaking with family members and friends being, when talking about this, is that there's a lot of well-intentions when it comes to wanting to help, especially from external sources, NGOs and foundations. One of the, obviously, as everyone has mentioned, it doesn't matter how medically objective and correct information can be. There's so much of an armor around it that comes in the form of culture and stigma. And I think the most effective places that I have seen the advocacy and that breakthrough happen is when those conversations are had by individuals that they can identify with. So in the case of the country director in Pakistan, her being from the community and being the person to have those conversations, I think is very important. It's not something that that's spoken, but it makes the difference from my perspective on being able to reach any type of or break down any barrier, but also to reach people with the information that you have.
Hi, let me jump in quickly.
Go ahead.
Oh, Khadija, please go ahead.
Okay, thank you. My advice to young people is to never give up, even when you are faced with opposition, even when you are faced with barriers. You go out there and you get the information yourself, and you push for other young people to get access as well. It is not just a you problem, it is a global issue. You know, it's not just the youth of your country, it's the youth of hundreds of other countries, you know, that are faced with similar situations. And everyone's situation is unique. So you basically have to advocate for what you want, which is why I stress that meaningful youth engagement is as important as anything else. Giving young people a seat or access to a seat at the table is imperative. If there's no seat, you create one, or you create your own table, but you do what you need to do to get the information that you need to help yourself and to help others like you. That's my advice.
Damilola, are you still connected and able to jump in on that too? They have frozen for a second, but that's okay. So then also thinking more broadly about these organizations that have been able to provide this support for you, or institutions or governments that are working on these issues at that higher level. Khadija, I think you've touched on it a bit about that meaningful youth engagement, but I would love to hear if there's also something that you really wish that these broader institutions keep in mind to help advance these efforts globally.
Well, that is exactly what I want them to keep in mind. I remember when many of our organizations decided that they were going to have at least 2 board members who are below the age of 25 serve on their boards. I think it's important that we not only give the youth a seat at the table, but we also engage them. You know, you ask them what are their wants and their needs. And like I said, everyone's situation is unique. Everybody's different. Everybody has different needs and wants. But as young people, it's all interconnected. So giving 2 more people a seat at the table helps chart a path forward for your organization or for your government or for your country, because you have versatility, you have the differences that you're going to need to make for young people to have like better access. And the difference is they knowing what they want and they knowing what they need. And it's unique to what older people will want, you know. The next generation has a voice, so why not allow them to use that voice to help themselves and the people who are coming after them? Thank you.
Thank you so much, Khadija. I encourage women and girls to persist even during the challenging period for their own betterment. And I will encourage women to ensure they give their best to themselves, and as well, whatever resources you know you can use to support fellow women and girls in the neighborhood, try as much as possible to give it to them. We are all trying to get our best. Every women have this need, every girls have this need to educate every girls around us. Let's try our best to give our best to every women around us, and women feminine hygiene for the good of all, both male and female. So there's no limitation anywhere, and if there are men in
We may have lost him for a second again, but I don't know, Saba, speaking to like those, the call to action then for these other supporting actions or organizations and institutions and governments. I don't know if you wanted to add anything around that too.
Yeah, I think what I originally said definitely could also apply here, but to Khadijah's point, and to platforms like this is just a great example of being able to have our voices heard. I don't think that's something that we're used to yet, but I love that there is such an emphasis around it. And even in the comments, there's so much support. So I would highly encourage that partnership to continue and to constantly have that diversity also in the room and conversations when talking about what's next.
Yeah, absolutely. Thank you all so much for sharing more about your story and your experience, as well as advice that you have for our peers in this space. I think this definitely is something that the conversation is really just getting started. There's so much more that we can be doing together, especially in that collaborative way. So now I'd love to jump into our Q&A from the audience around some of the stories that you shared. We have one question that's specifically related to COVID and if it's affected your work at all, and if so, how have you been able to overcome any of those challenges?
Go ahead, Khadijah. Go ahead.
Okay. So COVID, it put us in a very precarious situation where it hasn't been easy to do everything that we used to do before. Our poster campaigns are going into schools because for much of 2020, our countries are on lockdown. And while I commend the government for doing their part to stop the spread, because even in Dominica, there are a low number of cases right now. We maybe have like 2 to 4 active cases in the country. So I commend them for that. But COVID has slowed the process of advocacy. It has also basically, I think advocates we're already tired and drained and overwhelmed with all their work, and COVID made it harder for them to do that work. So a lot of people have taken a step back or put their plans and their ideas on a back burner because of COVID. So it has slowed our progress and it has slowed our work. But right now we are figuring out creative ways to, get back on the road, get back on the streets, get back into the schools. The vaccine program rolled out in my country, so a lot of people are getting vaccinated, so that's a good thing. So it'll be much easier for us to get into the schools, especially for the new school year, because between 2020 and 2021, we have basically taken a nosedive in our endeavors to get people the help that they need. So hopefully it'll get better for the 2021-2020 academic school year.
So I have a 2-part answer. One being the challenge, obviously, that has come. I think the conversation around women's health and rights is already a fight to get into conversation without a global pandemic. And, with the pandemic, it's just been that much harder to keep it top of mind and to keep it something that is focused on and something that is a priority. So that has definitely been a challenge to, try and navigate the conversation and really to remind people that it's all interrelated. COVID has affected women in developing countries far vastly. It's undeniable and from that perspective, but having to frame it in that way has been a bit of a challenge. And then the other part of it that I have seen is kind of a light, particularly for Pathfinder in their operating model, being that they operate and they work in countries with members of that community. So there wasn't a lot of, people leaving and having to come back because of COVID. The actual employees were living in those communities and didn't have to kind of leave, which I thought was just an incredible, ode to their operating model one in of itself, but also the ingenuity that has come out of how they have been able to pivot around the constraints around COVID and all of the different countries, and just seeing how the relentlessness of the people who are working there to not quit. Like Khadija was saying, it's very exhausting, it's very tiring. So to have people still want to find a new answer or find a new way is really inspiring.
Yeah, definitely that piece around keeping the energy and staying motivated, but then also being so adaptable. I would imagine it sounds like is definitely what's been core to that. I also have a question here. If there's a way for audience members to follow the work that you're doing. I know it looks like Damilola had hopped off, so I'll put a note for his organization in the chat too. But if there's more from either Khadija or Saba around how audience members can follow the work that you're doing and find opportunities to invest in the work that you're doing too, that would be great to share.
Okay, we have a Facebook page. It's Leve Dominique, and I'm gonna type it up in the chat so you could see it. So you could just find us on Facebook, Leve Dominique.
Also for Pathfinder and for the next generation leaders in Pathfinder and the Acacia Circle, we also do have social media. We have Instagram as well. So I am happy to share that to anyone who would like to follow or to get involved also.
Awesome. And is there any additional, are there any other questions from the audience? Before I then close it out and hand it over to Matthew. If not, thank you everyone so much for joining. Thank you, Damilola, Khadija, and Saba for sharing more about your story and your experiences here. This was really a wonderful conversation, and I'm so happy to be connected to all three of you. With that, I'll hand it over to Matthew.
Great, thank you, Shaylin, and everyone, Khadija, Saba, and Damilola. Unfortunately, we had to drop off. Fantastic forum, conversation. You see there's a survey that's dropped in the chat box, so I'd appreciate if folks could fill that out before you hop off. For me, these stories are inspiring. Keep fighting for sexual reproductive health, family planning, education services, transparency of information, breaking down sociocultural norms and barriers, so young women and men can take the right decisions for themselves and their bodies. And what can we do is some of the questions were put out there to help support these brave, I would say really brave, courageous, passionate, smart, creative young people in the work they're doing. So I want to thank also everyone who's joined us, fellow co-chairs, as Lara mentioned at the beginning, Lara Ho and Stephanie Vasquez from our health and nutrition work group, and then Christy Olenek and myself are on the youth and development work group. If you have any ideas for future work group events, the youth, the health and nutrition, feel free to reach out. The youth and development work group is exploring a systems related activity event where we have industry, government, young people, and civil society organizations, and how they are being responsive or can be more responsive to young people's needs. So keep a lookout over the coming weeks and months for that. So that is it. I really just want to thank all of you for this, and it takes time out of your day. You're busy. Congratulations again, Khadija, on your recent graduation. And with that, we'll close and enjoy the rest of your week, everyone.
Thank you so much. Thanks, everyone.
Thank you.